The first set of examples are from exodontia. Let's say if a patient wants to get his tooth number 35 extracted. 35 means lower left second premolar. As I told you, the main technique in mandible is inferior alveolar nerve block. So the answer to this question is inferior alveolar nerve block, because inferior alveolar nerve block, it anesthetizes the pulpal tissue as well as the buccal tissue and lingual tissue with respect to tooth number 35. Second example is extraction of 35 and 32. Now we have two teeth involved, but the inferior alveolar nerve block, it anesthetizes the pulpal tissue up to the midline. So basically 35 and 32, these will be extracted by just giving IA and B nerve block. Of course on the left side. Third example is extraction of tooth number 35 and 36. Friends, here's a catch. The inferior alveolar nerve block, it does not anesthetizes the mucobuccal periosteum related to molars in the mandible. So we need to anesthetize the mucobuccal periosteum for 36. In this case, we will give inferior alveolar nerve block plus long buccal nerve block. I just remembered that I forgot to discuss the long buccal nerve block. The long buccal nerve block, it is given when we want to anesthetize the buccal mucoperiosteum related to lower molar teeth. For the long buccal nerve block, we inject the solution just distal to the third molar or just distal to the last molar tooth present in the mandible. The only contraindication for long buccal nerve block is if there is acute infection or inflammation present at the site of injection. Let's move forward to the other example, which is extraction of 1-3. 1-3 means upper right canine. In maxilla, infiltration is the best technique, or infiltration is the first technique if we want to treat teeth 1 or 2. That is when the number of teeth to be treated are less than 2 or equal to 2, we use infiltration. Extraction of 1-3, this means we will give infiltration on buccal and palatal side. Other example is extraction of 1-3 and 1-5. Since here two teeth are involved, I told you that is if more than two teeth are involved, only then we will give infraorbital nerve block. But since here two teeth are involved, we will give infiltration. That is 2 infiltration, 2 on buccal side, that is 1/1-3 and 1/1-5, and 2 infiltrations on palatal side. Let's discuss few more examples. Disimpaction of 1/8. Even though this is a single tooth, but I told you that in case of disimpaction we cannot give infiltration, we need to give a nerve block. So basically the pulpal tissue of 1/8 is anesthetized by which nerve block? Yes, the posterior superior alveolar nerve block, plus since posterior superior alveolar nerve block does not anesthetize the palatal area, so to anesthetize the palatal area of 1/8, we need to give infiltration on palatal side. So for the disimpaction of 1/8, we will give PSA nerve block plus infiltration on the palatal side. Here comes the other example. Let's say if we want to extract tooth number 16, 17 and 18. Now, since 3 teeth are involved, we cannot give infiltration here because infiltration is limited to in the treatment of 1 or 2 teeth. Now 3 teeth are involved, and which anesthesia anesthetizes the palatal tissue for the anesthetizes the pulpal tissue of these teeth. It is posterior superior alveolar nerve block. So for the extraction of 16, 17 and 18 at once, we will give PSA nerve block. The PSA nerve block, it will anesthetize the pulpal tissue of these teeth. Also, it will anesthetize the buccal mucoperiosteum related to these teeth. But for the palatal tissue, we will give greater palatine nerve block. Some of you might be wondering why we didn't give infiltration. So guys, since here 3 teeth were involved, so when we have more than 2 teeth, we no longer give infiltration, we give greater palatine nerve block. Let's take another example. Extraction of 13, 14 and 15. So now, since upper 3 teeth are involved, we can no longer give infiltration. It will be better if we give here infraorbital. The infraorbital nerve block will anesthetize the pulps of all these teeth, plus it will anesthetize the buccal area of these teeth. For the lingual, since 1-3 is anesthetized by nasopalatine, 1-4 and 1-5 are anesthetized by greater palatine. But as I told you that nasopalatine and greater palatine teeth are greater palatine nerve block are only used when number of teeth are more than 2. So here for nasopalatine nerve block only 1 tooth is here. For GP only 2 teeth are here. We cannot give nasopalatine and GP here in this case, so we will give 3 infiltrations plus 3 palatal infiltrations. Let's go with another example. Let's say extraction of 1-3 and 2-3. Since these are from different quadrants, we will give 2 infill on buccal, 1 for each, plus 2 infill on palatal, 1 for each. Let's go with other example. So guys, in this case, we can give 2 inferior alveolar nerve block, that is bilateral inferior alveolar nerve block. But as I told you, we do not repeat any injection. So for one area we will give inferior alveolar nerve block, for the other we will give any supplemental injection, either intraosseous or intraligamentary. So inferior alveolar nerve block on one side plus intraosseous or intraligamentary. Some of you might be wondering why we didn't give bilateral IANB. We could give bilateral IANB, but for the ACJ exam we try not to repeat any injection. So for this case we went for IANB plus intraosseous or intraligamentary. Let's go with other example. Disimpaction of 4-8. Guys, I told you that for disimpaction we always need to give a block, either whether the tooth is in the maxilla or in the mandible. For 4-8 we will give IANB. IANB will anesthetize the pulp of 4-8. It will anesthetize the lingual soft tissue, but for the buccal soft tissue we need to give long buccal nerve block. Here are some examples from endo. Guys, before I start with the examples, I want to tell you that for any endo treatment, we always apply rubber dam before starting the root canal treatment. Only when we are performing pulpotomy, when we are not going into the pulp, in that case we don't apply rubber dam. But in every other case, wherever we go into the root canals, we always apply rubber dam. So while choosing anesthetic technique for the tooth in question, you always keep this in mind that you always have to apply rubber dam as well. So choose local anesthetic technique accordingly. So let's say if somebody wants to perform root canal treatment on tooth number 1-1. For 1-1, the pulp can be anesthetized by infiltration. Also, the buccal tissue and the palatal soft tissue can be anesthetized by infiltration, because we need to anesthetize the soft tissues because we want to put rubber dam and clamp. We will give infiltration. Tooth number 3-6, that is lower left first molar. The pulpal tissue of 3-6 is innervated by inferior alveolar nerve block. But we want to put the clamp as well. And we know that inferior alveolar nerve block does not anesthetize the buccal mucoperiosteum related to 3-6, so as to anesthetize the soft tissue on the buccal side. We need to give long buccal nerve block as well. Let's move on to 4-4 RCT. 4-4 means lower right first premolar. In this case we will give IANB. But we know that IANB, it will anesthetize the buccal as well as lingual soft tissue of this tooth. So we don't need to give long buccal nerve block. Only IANB will serve the purpose. Next is epicoectomy of 1-6. Guys, epicoectomy, though it comes in a periradicular surgery, but I thought I should discuss it with endo examples. In epicoectomy of 1-6, in the maxilla, you always give infiltration. Infiltration in maxilla. Same is the case with 1-7, infiltration. Let's move on to other example. Epicoectomy of 3-7. In mandibular teeth, while performing the epicoectomy, we need to give IANB plus. In case of 3-7, for the buccal anesthesia, we would give long buccal nerve block. But in this case, when we are performing epicoectomy, we need to control the bleeding. So as to control the bleeding, instead of giving long buccal nerve block, we will give infiltration, local infiltration. Let's move on to other example. Epicoectomy of 3-3. So in this case, same, IANB plus local infiltration. Always remember, in case of epicoectomy in maxilla, we give infiltration, and in case of mandible, we give inferior alveolar nerve block plus local infiltration. Let's move on to some other examples. From perio, let's say if you want to perform scaling in maxilla. That involves central incisor to third molar. In this case, we need to anesthetize the pulpal tissue, we need to anesthetize the buccal as well as palatal mucoperiosteum. So from central incisor to premolar, we can give infraorbital. From first molar to third molar, we will give PSA. On the palatal side, from central incisor to canine, we will give nasopalatine, and from first premolar to third molar, we will give greater palatine. So basically, if a dentist wants to perform scaling and root planing from central incisor to third molar, or you can say quadrant dentistry, then he has to give infraorbital nerve block, posterior superior alveolar nerve block, nasopalatine nerve block, and greater palatine nerve block. Let's say if doctor wants to perform scaling from 1.5 to 2.5, that is from second premolar on one side to second premolar on other side in maxilla. In this case, we will give infraorbital nerve block, of course, two infraorbital nerve blocks. The two infraorbital nerve blocks will anesthetize the pulpal tissue, plus it will anesthetize the buccal mucoperiosteum. For the palatal side, we will give nasopalatine nerve block. It will anesthetize from 1.3 to 2.3. But for 1.4 and 1.5, because these are only two teeth, and for two teeth we need to give infiltration, we will give 2 infil on right side and for teeth number 2.4 and 2.5 we will give 2 infil on left side. So basically infraorbital nerve block plus nasopalatine nerve block plus 4 infiltrations. Now if we want to perform scaling and root planing in mandible, let's say third quadrant. For third quadrant, we will give inferior alveolar nerve block. This will anesthetize all the pulps. This will anesthetize the lingual soft tissue. It will anesthetize the buccal soft tissue from midline to second premolar. For the buccal soft tissue, for the molars, we will give long buccal nerve block. Let's take other example. If a dentist wants to perform scaling from 3.3 to 4.3, guys, this is only specific for scaling and root planing. For scaling and root planing in the lower anterior sextant, that is 6 teeth, we need not give inferior alveolar nerve block bilaterally. We can give bilateral incisive nerve block. The bilateral incisive nerve block will anesthetize the pulps of these teeth, these 6 teeth, plus the incisive nerve block. It will also perform the mental nerve block. This will anesthetize the buccal soft tissue, and for the lingual soft tissue we will give infiltrations. 6 infiltrations. Let's take another example. 352, 45. This will also be the same. Now we will take some examples from operative. In operative, we always need to take into account whether we are putting a wedge or not. For example, class 2 restoration on tooth 3-7. So basically, if we are performing class 2 cavity preparation or class 2 restoration, whether it is mesio-occlusal or disto-occlusal or mesio-occlusal distal, in this case we need to put a wedge. The pulp of 3-7 will be anesthetized by inferior alveolar nerve block. But if we want to put the wedge, we need to put the wedge between 3-7 and 3-8 or 3-7 and 3-6 in case the cavities are mesio-occlusal. Then we need to put the wedge between 3-6 and 3-7. If it is disto-occlusal, then 3-7 and 3-8, and if it is MOD, then between 3-6 and 3-7 and 3-7 and 3-8. So since we know that IENB does not anesthetize the buccal soft tissue, we need to give long buccal nerve block. Other example. If instead of class 2, it was only class 1 restoration, then we don't need to give long buccal nerve block, then IENB would have been sufficient. I hope this video will help you to learn how to choose local anesthetic techniques when it comes in ACJ exam. If you have any other doubt or any other query, please don't hesitate to email me. You already know my address, email ID, which is hpsingh127@gmail.com. I hope you enjoyed this video. I'll soon come back with another video. Please don't forget to subscribe my channel and like my videos and share my videos. Bye.